morning. Arkansas football season, it just started, thankfully. And there have, unfortunately, they have been two injured on the Razorback football squad, and they are out of the game due to injuries. And we have Michael Hussey, an orthopedic surgeon who treats patients at CHI St. Vincent, here with us today. How are you doing, doctor?
Doing good. Thanks for having me, Todd.
What is the most common injuries, and what about these Razorback players? I guess that what they experienced were very common.
Yeah, I mean, you know, according to our the data that we have, the most common orthopedic football injuries that we see are typically lower extremity injuries. Actually, about 50% of football injuries occur to the lower extremities, with ligament injuries to the knee, like ACL injuries, being most common, ankle sprains after that. Typically in my practice, I specialize more in shoulder and arm injuries, so I actually see a lot of labral shoulder injury, especially in linemen, due to blocking. I also see a lot of shoulder dislocations, shoulder separations, which typically occur after a hard fall or hard impact with the ground.
How permanent are these injuries? I mean, they're obviously treatable, but are they going to be with them their whole life?
No, not typically. Actually, the good majority of injuries are able to be treated, a lot of them without surgery. And typically they're able to get a full rehabilitation, and they're able to get back to sports without any lingering effects.
Are there some football players that are more likely to be injured than others?
Yes. Well, you know, there's a common misconception that I think kind of quarterbacks are probably the most injured out on the football field, but actually our data shows that other position players such as linebackers, running backs, receivers actually sustain a higher rate of injuries than quarterbacks do.
Really? Well, I guess because quarterbacks usually got some protection.
Sure.
At least you hope that your quarterback's getting protection from the offensive line. It's just the nature of the game, and it's not just football. You're seeing injuries in all different sports, but football obviously gets a huge bulk of those.
Right. I mean, football is a contact sport. It's high impact, so you do see quite a few injuries related to that. But just like with any other sport that requires either rapid acceleration, frequent pivot changes, changes of direction, fast sudden stops, you see a lot of joint injuries. It's not just with football. You see it in basketball and baseball and other injuries in other sports.
I know with technology, the pads and everything that, you know, they're always trying to improve helmet safety and all that, but what can these players and coaches do to protect their players from these they're violent blows on the football field, but what can they do to protect themselves? Right.
Well, I mean, you know, as far as prevention goes, usually we try to talk to players. There's some different tips that we can give. First off, before any game, before any practice, we always encourage players to warm up. We know that cold muscles are more prone to injury. Also, after the game, after practice, always cool down, stretch, condition. You know, the coaches are very good about conditioning their players before the season, but they also need to continue that conditioning even throughout the season before every game.
You're telling me the most common football injury is the ACL?
Probably one of the most common. ACL, MCL of the knee are most commonly seen that we typically see.
It seems like so long to be out for that. You told me 6 to 8 months to be out for something like that.
It can be. It just depends. It depends on the grade. If it's a partial tear, those typically can heal quite fast, and they may be able to get in with bracing. But if it's a complete tear that requires surgery, they're looking at several months before they're finally getting back in.
All right. And of course, we are always concerned about the safety of our players on the field. But thank you very much for coming on. A very busy time of the year, unfortunately, for you.
Definitely.
But great seeing you.
Todd, appreciate it.
All right, keep those guys healthy. All right. There's more information on Arkansas Specialty Orthopedics here. And you can have a clinic. They have a clinic that's going on tomorrow from 9 until 11 o'clock. The phone number for more information at the bottom of your screen, 501-831-8844. So they've got a special sports injury clinic going on. All right.